The Operating Department Practice course is a full-time course and is spread over 3 years. You will, of course, undertake a lot of theory here at the University of Portsmouth, but you will also spend 50% of your time out in the clinical placement area. In your first year, we will go over a lot of theory with you before you actually enter the practice area, and that's so that when you do go into the practice environment for the first time, you understand what is going on and have some knowledge so you can start to work towards your skills. Placements itself is conducted in NHS hospitals, but also in the private sector, and we currently use 15 hospitals around the south coast. When you're at the University of Portsmouth, one of the things that we use a lot of is what we call simulated practice. The idea of simulation is that you can build those skills up alongside your knowledge without contact with patients at that time.
The role of the Operating Department Practitioner, we would support the anaesthetist with anaesthetics and intubating a patient. As a scrub practitioner, you are there to ensure that the patient is safe and your team is safe. You are responsible to make sure that everything that goes into that patient comes out of that patient, and you are there to anticipate what the surgeon's going to want next. We are there to support patients post-operatively, and we are there to manage their airway and ensure they are safe to be discharged to an area of lower dependency. Before you receive a patient into recovery, you need to make sure that your area is safe. So you need to make sure that you have oxygen and you need to make sure that you have suction. You then need to check your airway trolley to make sure you have all the correct equipment. So we're going to think about an A, B, C, D, E approach. Airway, first of all, I need to make sure that I have a selection of airway adjuncts. So I've got some Goodell airways, I've got my nasopharyngeal airways, I've got my oral pharyngeal airways, I've got some eye gel devices, some endotracheal tubes, and I've also got a bag valve mask to deliver oxygen if need be. For circulation, I've got a stethoscope, I've got some IV access, I've got a blood pressure cuff, which will be connected to my monitor, a pulse oximeter, which will tell me the patient's heart rate and their oxygen levels. Fast forward time, I've received my patient. First thing I need to do is monitor the airway. So you'd introduce yourself. Hi, my name's Josh. I'm here to look after you. And if the patient isn't breathing, you could potentially need to open the airway and give the patient some oxygen. If the patient then starts coughing, what you'd want to do, sit them up, and then go through the rest of your checks. So I'm just going to sit you up, Mr. Douglas, and then you can carry on with your checks. So I would like to check my blood pressure, I'm going to check my breathing rate, I'm going to check my pulse, and I'm going to have a look to make sure that there's no rashes or anything nasty.
Okay, Josh, so we've talked about the theory of ventilating with this bag valve mask. So what I want to do now is demonstrate that, and then I'm going to get you to actually attempt that. This apex here, we want to place that first on the apex of the nose and then allow the mask to go onto the face. So we're going to form that big C with our thumb and forefinger onto the mask to put some pressure down to form a seal, and then those fingers, remember, they're going to go onto the jaw. And then we just pull up to extend that neck. So we've got a good position and we've opened that airway up. We're then going to take the actual bag itself, and what we're looking to do is to try and get about 500 mils in. I'm not going to squeeze the whole bag. See how the lungs there now are inflating? Not too quickly, because we're trying to demonstrate a normal intake of breath. So that's what I want you to do. That's right, so yep, so get that apex over the nose first. That's good. Take that hand and place it onto the head, and then pull that head back. That's it. Go as far as it will allow you to do. Try to inflate the lungs by squeezing the actual part of the bag on the BVM. See, now we're starting to see some lungs, so that means we've got a seal. It also means we've now opened that airway up appropriately. So we can now take over the ventilation for this patient when they're not breathing. So what I want to do now, we did talk about when we talked about the theory that we could be trying to ventilate the patient as you've just done, but that we find that we're not really getting much inflation of the lungs, which could be that we've still got a bit of occlusion with the base of the tongue. We talked about a device called an oral pharyngeal airway. So the way we size this is that we're going to place this so that the top is at the corner of the mouth, and then we're looking for this part, this concave part on the tip here, to be roughly at the angle of the mandible. Okay, and that looks about the appropriate size. Now to insert this, again, we'll put the head tilt chin lift on. And we're going to, first of all, have the concave facing towards me. And when I first place this into the oral cavity, all of a sudden I hit resistance. And that's because that is now has hit the hard palate. Once we hit the hard palate, What we do is we put a little bit of pressure but twist at the same time, and that will then twist around the base of the tongue into position. And then so when our patient starts to wake up, if we want to remove it, we just take it out like so. So that's it, yeah. So making sure the top bit is at the corner of the mouth. So if you take this hand and hold the head, and now a little bit of downwards pressure and rotate at the same time, and you should feel it slipping around the base of the tongue. Can you feel that? That looks good. So that's now in situ. So if we want to use that, we'd now go to the bag valve mask, and we would then ventilate with that, okay, the same way as you did before. So if you want to show me how that's going to be removed, that's brilliant. The University of Portsmouth is also very, very proactive in supporting you as students during your 3 years with us here. I hope that's given you a little bit more insight about the Operating Department Practice course here at the University of Portsmouth, and a little bit of a flavour about simulated practice.